Dr. Angelique Coetzee joins us now on the line. Dr. Coetzee, a very good morning. Thank you so much for making the time. Difficult decisions. The World Health Organization says schools should only be open in the context of low community transmission rates, which you agree with. How can South Africa achieve this when we're trying to fight against inequality at the same time as we're fighting COVID-19?
Good morning to the viewers out there. Yeah, it's a very important question that you are asking. Currently, it seems that we are not winning the battle against the virus. Again, what is important to understand is that in certain communities, there would be a low viral outbreak. In those communities where there's not really community outbreak, one can safely say, okay, let's start and return back to school, again, with a bit of a rotation that not all the grades are at school at the same time, but rotate some of the classes or the grades so that you have maybe on one given day only 2 grades at school and the next day you rotate with someone else. That is in the areas where there's low outbreak. We need to understand that it's not in each and every town and each and every city that there's a high outbreak. So in that case, you'll have to start to open up the schools. The reason also is that a lot of children need the social entertainment from their friends. They need to be with their friends. The socializing is quite important for these young people. But in areas
I find that
where
a bit
there's a significant outbreak.
Dr. Coetzee, isn't socializing prohibited at this time, even though they will be together in a class?
Socializing, as long as you are 1.5 meters apart, is totally allowed. You cannot say to children, you cannot speak with your friend if you are 1.5 meters from each other. But you cannot, the isolation at homes for some of these children is quite devastating. We are seeing anxiety rising under the young children to be sort of locked down only in the home with their parents or other siblings. It does have a toll on their emotional status. So socializing by speaking to my friend, by just seeing my friend, just being among other people, keeping your 1.5 meters is actually something that you are now starting to teach these young people to respect space around them and that you can still have friendships if you are staying the social distancing apart from each other. That is especially where there is low outbreak. We're not saying that all the schools must be closed right across the country of South Africa. We need again to look at low outbreak and try to do something there to get those children back to school.
The study is showing that the coronavirus doesn't generally make children as sick as adults, especially the one that came from the National Institute of Communicable Diseases, showing that children made up less than 7% of all reported COVID-19 cases. How do these studies impact the conversation about whether or not children should be going to school?
Well, again, that's why if there's a low outbreak or a low community spread in a certain geographical area, you need to open up those schools, as it is absolutely correct that children doesn't get as ill. Most of them will be not having symptoms. They will be symptom-free. They will be more carriers of the virus than they themselves get sick. Again, if there's no adult or elderly people staying with children at a home, it would be then, there's no need to panic then to send that children after school back home. Again, we keep on saying the whole time, you use your mask, do your social distancing. Social distancing is part of our lifestyle going forward. This virus is not going to go away this easily. So if we can teach the children 1.5 meters, go home, be with your mother and dad, when your kids from school, go and shower, or stay away from elderly people, 1.5 meters. We're not saying you should never be in contact with other people. It's always the 1.5 meters. So please, we need to enforce this. People think that once if they go out of the school, going home, the 1.5 meters is gone. When you're home, you don't need to do anything. You can carry on life as always. It's always 1.5 meters until you shower, until you wash your hands when you get home, and then you should be safe.
Do you agree that it's a confusing time for parents and learners in an environment where there are regulations, the ones you've just spoken about, the protocols that they have to follow, and on the other hand, they have to take these decisions about whether they live in a good enough area to allow them to send their children back to school? Quite a confusing time, would you agree?
Your audio is not very clear. I'm trying my best to hear what you're trying to ask me. Can you just repeat the last part, the question itself?
I was just asking you if this is not a very confusing time for parents and learners in an environment where government is sending out guidelines, the very guidelines that you have just outlined. And on the opposite side, the parents and learners themselves have to make their own individual decisions based on the areas they live in, the level of infections in their affected areas. Quite a confusing time, would you agree?
I would agree, and the reason why it's confusing currently is because there's no good stats coming out every day on a daily basis telling us exactly which geographical area is having a problem and which geographical area is a hot spot. We don't even know ourselves as doctors which areas does have enough hospital beds or not. We don't know. We don't know which doctors are affected because there's no proper data out there on a daily basis that's being upgraded. So if we can understand that in a certain rural area, there's virtually no COVID-19 cases, then those children, as we have said, on a rotational basis, can go back to school and keep on having 1.5 meters, the mask, the hand washing. That is a ritual that needs to stay with you wherever you go, whether you are a child, whether you are the teacher, whether you are the mother, whether you are the father. So once my child is home from school and you as a parent have elderly people living in your home and you are afraid that the child might be a carrier, then what you do is you keep on enforcing the wearing of a facial mask at home. And then again, if there's people in the home that is in danger or would be physically in danger, medically in danger, if they contact the virus, then you teach the children to stay 1.5 meters away. That's never going to go away. That is the normal, that's the new norm.
Yeah. There's one conversation that we haven't been having sufficiently, I think, and I wonder if you're able to contribute to that conversation, a lot of encouragement to people in South Africa, all over the world actually, to boost your immune system. What can people do to boost their immune systems at an individual level outside of consulting doctors?
Okay, there is, unfortunately, currently we have a stock out on zinc tablets, but zinc is a very important thing that you can take 1 tablet a day. Vitamin C, when you are sick, it is 1,000 milligrams 3 times a day. If you are not sick, it's 1,000 milligrams once daily. Vitamin D, also very important. Calciferol currently also out of stock in South Africa. putting a huge burden on what one can do out there. And again, health, vitamin B, also important. But try to be healthy. Try to walk. If it's possible, walk. If it's not possible and you cannot walk, then so be it. But if there's something that you can do as a person for yourself, do it. Unfortunately, there's no magic out there. If there was, that guy would be a millionaire by today. And as I said, half of the medication or supplements are currently out of stock. So we are stuck with what we have.
Yeah. Dr. Coetzee,
and stress levels that is elevated, especially at work, also contributes a lot.
And the trauma with all of the people dying and all the reports of more infections, quite traumatic.
Yeah.
What are your thoughts about...
Yes, it's very traumatic.
Just give me your thoughts about government's decision to take public transport, especially taxis, back to 100% occupancy when it had been at 70% all along. What are your thoughts about this development?
Well, it doesn't make any sense because it's clear from the studies and from the WHO that close contact, and now we're coming back. What is close contact? Close contact is less than 1 meter apart from each other, less than 1 meter, not more, less. So close contact with any person should not be longer than 20 minutes. So for us as doctors, we are even advising our doctors to not be in close contact for longer than 15 minutes, wearing your 3-ply mask or your N95. Now, remember the mask that the average person out there is a normal cotton mask, whatever the material is that it's made of. That mask is only saying, I protect you, and if I am positive, I would spread 50% less. So therefore, I will wear my mask. And if you are longer than 20 minutes next to a person who really doesn't have the correct masks on, which again, we cannot ask everyone out there as there is still shortages of good quality masks, you will run the risk of contacting the virus if we are 100% loaded into a taxi, especially if the windows are not open. Now, just to use this morning as an example, 4 o'clock or 5 o'clock this morning, it was bitterly freezing cold out there.
Absolutely. 1%
so we are
in some
advising
areas.
If you are 100%, open up the windows. So all the diseases that will happen there. But that's unfortunately what it is.
And also another conversation about the reintroduction of the ban on alcohol. And today, the cigarette manufacturers are in court trying to fight their battle again. What are the medical conversations taking place around these developments?
We understand why this ban is coming back. It's important for this ban to come back because the burden on the casualties are extremely high. Emotionally, for the doctors and the nursing staff, it's not easy to cope with the burden of people who has been drinking, coming in with stab wounds, demand healthcare, while you are busy with real other people fighting for their lives, and you are the only doctor, or you are only 2 doctors on call, and you have to look out after each and every one, need to prioritize while you're still struggling to keep a patient alive. And maybe some of these stab wounds or trauma that we will see regarding, or that's alcohol related, can also be extremely emergency orientated, that you will have to immediately need to put your attention or give your attention to that patient as well. So it is right that it's back, but we are saying that is only putting a elastoplast onto a festering wound. And the reason why people are drinking, why South Africa has this high alcohol abuse, is not being addressed. We're only fixing a short-term problem. The socioeconomic impact of alcoholism is a long-known problem in our country.
Dr. Coetzee,
I can't find a lot of studies where there was definitely input given into communities who struggle with this and made a difference.
We've just been
now
reminded.
we are trying to say.
We've just been reminded that we committed to release you early for another commitment. So let's thank you at this point for talking to us, and thank you so much for your thoughts. Very valuable.
Thank you.
Dr. Angelique Coetzee there.